Hello, I'm Marisol Lopez. Today is November 15th, 2021. Okay, I will be presenting today on the heart, and I have already dissected it so that I can present the interior and the exterior, the anterior and the posterior views of it. I will be naming off the different structures. And when I'm done with that, I will be speaking of a common disease of the heart. So I'm using here additional light. Hopefully I am able to show you clearly the interior of the heart. All right, so we will begin. Okay, here is the heart. And here, this is the interior view of it. Okay. So here is the brachiocephalic artery, the aorta. Bring it closer. The aorta right here. Okay. Here is a pulmonary artery. Okay. All right. And here is the left auricle, left ventricle. Here's the right auricle, the right ventricle. And here is the anterior interventricular sulcus. All right. And that is the anterior view. Then for the posterior. Okay. So once again, for the posterior, here we have the brachiocephalic artery. Here's the aorta. Here's a pulmonary artery. Here's a pulmonary vein. Okay. The right auricle, right ventricle, left auricle, left ventricle. And here is the posterior enteroventricular sulcus. Okay. Yes, and then right here, it's a little hard to see on this particular heart, but here's the opening for the superior vena cava and would reach down to the inferior vena cava. Okay, so now I will move along to the inside of the left side of the heart. Okay, so I have additional lighting. I really hope that this is clear. All right, so let's see, maybe if I use this to open. Okay, all right. So here I have, up here is the left auricle, left atrium, it's on this side, okay? Then the inside of the left ventricle on the lower, okay, left ventricle. In here we can see the bicuspid valve. All right, and the heart has 3 layers of muscle. So the outermost layer would be the epicardium, the middle layer would be the myocardium, and the inner layer would be the endocardium. Okay, so on the inside, oh man, right here would be the papillary muscle area. Okay, and then we have, there's kind of like some webbing right here. And that's the chorda tendineae. All right, I see if you could bring it closer. There we go. Oh, perfect. Chorda tendineae. Okay. All right. So now we have the right side of the heart. Let me, how's that? Okay. All right. I will hold it from the bottom to focus on the top area. So once again, the brachiocephalic artery up here. And here is the right auricle. right auricle right here. Okay, right atrium right here. Okay, and now I'm gonna hold it from the top to focus on the bottom. Okay, then here is the right ventricle. Okay, the tricuspid valve in here. Okay, and down here, the chorda tendineae and the papillary muscle. Yeah. And the, I don't know if I mentioned before, the ventricular wall. So the ventricular wall on this side and also on this side on the bottom would be the ventricular wall. All right. So that is the structures of the heart. All right. Okay. Okay, so now I'd like to speak of a common heart disease. So for a common heart disease, I have chosen to speak of the coronary artery disease. So what happens in this disease is that the blood flow is decreased to the myocardium. And so the blood flow decreases. So when the blood flow decreases, it causes the person to feel like they have shortness of breath and perhaps chest pains. And this is very serious. So ways to self-prevent it would be to attempt to lose weight, exercise, maybe stop smoking if they're a smoker, and probably consume low-fat diets. Doctors would probably recommend medication, which would be like beta blockers, maybe calcium channel blockers, and surgery is definitely a possibility. This disease is incurable, but it can most definitely be treated. So that is all for my heart structure and heart common disease. Once again, Marisol Lopez, November 15th. Thank you.